Okay, looks like everyone has joined us, so good afternoon, and thank you for joining us for this media briefing about COVID-19 vaccine approval and rollout in the NWT for children aged 5 to 11. My name is Ali Kincaid, and I'm the Manager of Cabinet Communications. As a reminder to all guests, please mute your microphones until you are called upon to limit any potential feedback. Providing remarks this afternoon will be Premier Carolyn Cochrane, Minister of Health and Social Services Julie Green, Chief Public Health Officer for the NWT, Dr. Kandola, and also joining us to answer questions from the media is Territorial Medical Director, Dr. AnneMarie Pegg. As usual, following the remarks of our speakers, we will open the floor to questions from the media. I will run through each media outlet present one at a time, and everyone will have the opportunity to ask at least one question and one follow-up question to our panel. If you don't have a working microphone to ask your question, please type it in the chat and we will read them for you. I will now turn things over to Premier Cochrane to deliver her remarks.
Thank you, Ali, and good afternoon, everyone, and thanks for being here today. The announcement last week by Health Canada and the Public Health Agency of Canada on the approval of the Pfizer vaccine for children aged 5 to 11 was an important milestone in our fight against COVID-19. Today, we're really pleased to be here to announce that 6,000 doses for children aged 5 to 11 will arrive in the Northwest Territories later today, and we'll be launching our vaccination program soon after. This is enough to provide a first dose to every eligible child aged 5 to 11 and begin providing the second doses where possible. Parents and primary caregivers will be able to book their eligible children for the vaccine starting later today. Minister Green and Dr. Kandola will have more on the vaccine rollout momentarily. With the recent and continuing outbreaks across the NWT and Canada, getting vaccinated remains as important as ever. Schools are considered high-risk environments for the spread of the infection, and getting your child vaccinated is vital to protecting them from COVID-19. Vaccinated students help prevent infections from occurring in schools and allow our schools to remain open for in-person learning. The approval of a vaccine for this age group and the imminent rollout of our vaccine program brings us closer to getting back to a more normal life. By vaccinating children aged 5 to 11, we're going to increase our overall vaccination rates across the territory, which allows us to begin looking at when we can begin to ease the restrictions and eventually end the public health emergency. As always, we're in the position we are because of the hard work of residents and communities to stop the spread of COVID-19 by following the public health orders and the recommendations and by getting vaccinated. Because of these efforts, altogether, we've been able to ease the restrictions where possible. Before I turn it over to Minister Green, I want to remind people to make informed decisions about travel this holiday season. The risk of COVID-19 importation as a result of travel outside the territory remains a reality for our residents. If you're traveling over the holidays, it's important to understand the risks and plan for safe travel. Please be familiar with the public health orders in the jurisdiction that you're visiting, and be aware of the locations where COVID infections are increasing, especially for those who are unvaccinated or partially vaccinated. Thank you again, everyone, and I'll turn it over to Minister Green.
Thank you very much, Premier, and good afternoon, everyone. On November the 19th, Health Canada announced its approval of the Pfizer vaccine for children ages 5 to 11. Our healthcare team across the Northwest Territories is ready to roll out a robust vaccination campaign aimed primarily at the parents and caregivers of 5 to 11-year-olds as soon as the vaccine arrives. We've learned valuable lessons battling this pandemic over the last 2 years. Our vaccine teams are experienced and well-trained. In addition to their technical expertise, they're able to provide information and resources to parents and caregivers and to children themselves about the safety of the vaccine and explain to them why it's so important, particularly in the Northwest Territories, for kids to get vaccinated. As you know, some parents are uncertain about vaccinating their children. I understand that parents and caregivers may be cautious when it comes to immunizing their children. Our vaccination campaign includes significant efforts to educate parents and caregivers about why vaccinating their children is so important, particularly in communities where children and elders live in the same household or are in regular contact. As the Premier said, the first shipment of 6,000 doses is expected to arrive later today. We will then be making appointments available for children in Yellowknife beginning this evening at 5:30 p.m. These appointments can be booked online at nthssa.ca. Clinics in other communities will be announced as we distribute vaccine across the territory. This deployment will begin right away. Our plan is to ensure every eligible child in the territory has an opportunity to receive their first vaccine dose by December 15th. As our hardworking team of healthcare workers has demonstrated over the course of this pandemic, we can do this. If you are the parent or caregiver of a child in this age group, I urge you to consider vaccinating your child. If you want to learn more about the safety of the vaccine, please visit GNWT's COVID-19 website. I will now ask the Chief Public Health Officer to give her remarks. Thank you.
Good afternoon. As you've heard from Premier Cochrane and Minister Green, the vaccine for children ages 5 through to 11 will soon arrive in Northwest Territories. And the team at NTHSSA is working hard to deliver doses safely to all the health centers across the Northwest Territories. In the last 11 months, NWT healthcare providers have administered over 85,000 doses in the territory. So they are prepared to continue now with children ages 5 to 11. So this is a great day. The vaccination of children 5 to 11 years old is a turning point for NWT's pandemic response. Implementing a vaccination program for children in this age group will protect children and result in less schooling disruptions, social isolation, and more access to resources that impact mental and physical well-being of children and their families. So we are talking about children today. And when we think about the overall effects that COVID-19 has had on this age group, we must acknowledge those in direct harms. When they get the shots, these children will know that they are safer and can also get back to the things they love and need to flourish. I am confident in the safety and effectiveness of this approved vaccine for children in this age group. The Government of Canada, specifically Health Canada, has reviewed the clinical trial data and determined that the vaccine is safe and effective. The National Advisory Committee on Immunization recommends that we offer all children ages 5 through 11 the vaccine. The only reason a child should not be offered the vaccine is if they're allergic to it. Healthcare providers can help navigate options if children have an allergy to the vaccine. As with every vaccine approved by Health Canada, its safety and effectiveness is monitored as more and more people receive it. Canada has a strong monitoring system for all vaccines and additional programs specifically for monitoring pediatric vaccinations. The active surveillance system for pediatric vaccine safety and effectiveness is called the Canadian Immunization Monitoring Program, also known as IMPACT. IMPACT has been monitoring the safety of childhood immunizations for more than 20 years. In addition, the US FDA authorized this vaccine on October 29th for use in 5 to 11-year-olds. They have now delivered at least one dose to over 3.6 million children in this age group. Parents and families of children ages 5 through 11 have waited for the vaccine to become available, and it's felt like a long time. Personally, I felt relief as I signed up for the vaccination time slot when my own child was eligible for the vaccine. For parents of children younger than 5, please stay strong as the process unfolds to authorize the vaccine in this age group. Continue to practice healthy habits, take necessary precautions, and hold on. Vaccinating children ages 5 through 11 will protect children and improve well-being in the NWT. As more and more young people are vaccinated, it does reduce the risk of school introduction and outbreaks. Children protected by vaccines means they can stay in the classrooms. Staying in classrooms keeps children connected and provides access to important supports for mental and physical well-being. It's important, though, that parents continue to monitor their children and keep them home if they are having signs or symptoms of COVID. Most children with COVID-19 have no symptoms or experience mild illness. While the vast majority of Canadian children with COVID infection have mild illness, some have experienced severe illness that required hospitalization. In extremely rare instances, a COVID-19 infection has resulted in death, even in children. The long-term effects of a COVID infection in children are less understood. There's uncertainty about the long COVID in children and its risk. Available data does not suggest a high risk of long COVID in children, but ongoing monitoring is necessary. So preventing COVID-19 in children is important. Choosing to vaccinate your child increases their protection against these rare outcomes and potential long-term complication. But it also protects others, protects family members by preventing introductions of COVID into households. It protects the whole community by preventing exposures in a circle of friends or in adults whose daily lives require them to work or live closely with children. By preventing community exposures, vaccinating children protects those at high risk of severe outcomes of COVID-19. The National Advisory Committee on Immunization recommends that the interval between the first and second dose of the COVID-19 be at least 8 weeks apart for this age group. I am aligning our vaccination delivery program with that recommendation. The evidence in adults also suggests that a longer interval between the first and second dose could result in a more robust immune response and higher vaccine effectiveness. The research has also shown that the first dose provides some protection against acquiring a COVID-19 infection, but the second dose is required to maximize the strength and duration of that protection. Earlier this week, I announced a decision to allow children that have received 1 dose of the COVID-19 vaccine with a few stipulations to be exempt from self-isolation. The pediatric clinical trial for this age group was done with the Delta variant, has the predominant strain, and it showed 91% efficacy. For parents that have already taken their children for their flu shots, it is important to note that 14 days must pass before your child is eligible for the COVID-19 vaccine. While I wholeheartedly encourage residents of all ages to get vaccinated, I recognize that this is a personal and sometimes difficult decision, especially when parents and guardians are making decisions on behalf of their own children. It is natural to feel anxious. Please reach out to your healthcare provider for discussion and have your questions answered. If you are going to look online for additional information, please ensure it is from a trusted and reputable source. This is an exciting day for our residents, and I've heard from many parents that they're excited about the availability of vaccine for their children. Please continue to show your fellow community members compassion as they make their own personal decisions about the COVID-19 vaccine and respect their choices. Thank you.
Thanks, Dr. Kandola, and thank you to Minister Green and Premier Cochrane. We'll now move on to the question period of our media briefing this afternoon. I would like to remind you to please indicate who you would like to direct your questions to before you ask your question. And if you aren't sure, I will help you to direct it to the right person. Again, please mute your mics until called upon, and I will run through the media list here. First, we will go to Clara from CBC. Clara, do you have a question?
I do. Thanks so much. My question is, are there any specific things that are going to happen to make the experience more child-friendly? We've heard of interesting things happening in jurisdictions across the country, and we're wondering what parents can expect. Maybe they have a little one who's a little more nervous, or just if there's anything that they can expect that might be a little bit different than what we've seen in adult vaccination experiences.
Thanks for that. I think Dr. Pegg might be able to speak to the specific initiatives there.
Yeah, for sure. We're working really hard to make sure that the experience of vaccination is as enjoyable is probably not the right word, but as pleasant for the kids as it can be. Some of those things have included, provision of snacks and juice boxes, some fun pictures on the walls that they can use to take pictures, some distraction techniques, stickers once the kids have received their vaccine. The organization of the vaccine clinic also is designed to be more child-friendly, with appointments being booked for up to 2 children at a time, with their parents able to accompany them, and longer appointments being booked so that there's some time to go through any questions that parents may have, go through any questions that kids may have, be able to explain the process to the children, and do it in a less rushed and less clinical manner, and make sure that the kids are able to ask any questions or to get rid of any worries that they may have. The nurses who are administering the vaccine have a lot of experience with childhood immunizations. This is something that we do a lot of in the Northwest Territories. And certainly as the vaccine campaign rolls out, there may be community-specific endeavors that roll out, again, to make the experience more fun for kids.
Thanks, Dr. Pegg. Clara, do you have a follow-up question?
Yes, this question is for Dr. Kandola. I'm wondering what she would be recommending in terms of schools making vaccines mandatory, and if not, what vaccination rate does she believe that we need in the child population? Is there a target there?
So to answer question number 1, we will not be making vaccines mandatory. This will be a decision made by the parents and caregivers with information provided by healthcare providers. We are looking at the overall population coverage. Right now, we have 70% of our population are fully immunized. So the more people we can vaccinate, the better impact it will be to decrease the spread of COVID and have lower case counts. And I'm not just speaking about NWT, speaking about across Canada. What we have seen is that we've had excellent uptake in the eligible population 12 and older, but unfortunately for those kids who are not yet eligible, the fastest growing rate of COVID infection has been in the children under 12. We do recognize that our largest unvaccinated cohort are the elementary school children, so we're hoping that if we get as many children vaccinated as possible from the ages 5 to 11, that we will have less school disruptions, less COVID transmission, and less impact on the households and less impact on the communities.
Thank you, Dr. Kandola. Next on my list is Emily from Cabin Radio. Emily, do you have a question?
Yeah, I'm hoping to get some clarity around isolation requirements for children who are unvaccinated. It's my understanding that birthing families returning with newborns will not need to isolate. Is that correct?
Dr. Kandola?
So for newborns, from 0 to 6 months, the isolation requirements will reflect the vaccination status of the parents. So if parents are fully immunized, then that newborn doesn't have to isolate. If the parents are partially or unvaccinated, they follow the same isolation requirements as the parent. And for unvaccinated children, they follow the same requirements that we currently have. It's 10 days with an exit test on day 10.
Thanks for that.
Sorry.
Go ahead, Emily. Do you have a follow-up?
Yeah, sorry, some of that answer cut out for me between when you said that, I guess for newborns, the vaccination status of the parents is what's considered. And then what the part that cut out is like who would still have to isolate for 10 days.
So later on December, we're revisiting the travel isolation, the travel restriction self-isolation order. And so there will be some changes for unvaccinated children under 12 whose parents are fully immunized, but specifically for the newborns, the newborn isolation will reflect the vaccination status of the parent. So the mother is fully immunized, the newborn is not required to isolate upon return. If the mother is not vaccinated or partially vaccinated, she will follow the isolation requirements of our self-isolation plan.
Thanks, Dr. Kandola. Okay, Emily, now a follow-up question if you have one.
Was there sort of a timeline for when the government is considering looking at those isolation requirements for children?
The initial timeline would be, so for the right now for the newborns, fully immunized mothers, they have to apply for an exemption, but their newborn will be exempt from isolation. So that has an effect right now. They just have to apply for the exemption process. But we will be updating the travel restriction self-isolation order to formally recognize that. And we'll be looking at isolation requirements as well for children under 12. One of those isolation requirements that I have formally announced that will be formally reflected in the order is that if children receive their first dose of the COVID vaccine between the ages of 5 to 11 and they travel out, if they're 14 days past their first dose when they return, they'll be exempted from isolation and just require day 1 and day 8 test.
Thank you, Dr. Kandola. Next is Ethan from NNSL. Ethan, do you have a question? Oh, Ethan is telling me in the chat he doesn't have a question, so I'll move on to CKLB. Do we have someone here from CKLB? Nobody asking anything from CKLB. Okay, I'm going to go back to CBC. CBC, do you have another question?
Can you tell us, this is probably for Dr. Kandola, I'm wondering if you can tell us a little bit more about what's needed to protect kids who, there are going to still be kids who aren't vaccinated. You'd spoken a little bit about this younger group or just those who haven't been vaccinated. What more is needed to be done in schools, or what would you recommend can change as a certain threshold is reached?
So right now, we're averaging about 2,600 cases daily across Canada, and we are heading into the winter months. So we do anticipate an increase in transmission. We hope out with this rollout of this 5 to 11 program that it will decrease those daily case counts. Specifically, we're going into the holiday season, so we're going to see an increase in travel. So we do anticipate as we move out of community transmission in NWT, we will be looking at an import risk of people coming in with COVID to protect schools, because we'll have still have a mixed vaccine status in schools. We won't be fully rolling out or anticipating kids will be fully immunized until 2 weeks after the second dose. So that brings us 10 weeks. The way we can protect children is how we're protecting them now is continue having the mandatory masking in the classrooms, have the school screener. So any child who's sick or have any symptoms of COVID stays home, gets tested, continue with the bubble classroom activity, limit high risk activities, and physically distance when you can, wash your hands. This is a bundled approach that will keep us safe for the winter, and will keep the kids safe for the winter, all kids, including those kids who are not vaccinated.
A follow-up for either Dr. Pegg or Dr. Kandola. I'm wondering what advice you would have for parents that might have a child on the cusp between 11 and 12. Maybe they have a child that's going to turn 12 in the new year or something like that. would you recommend they get this dose immediately, or would you recommend they wait? And, what factors are being considered there? I think, it might be a little bit confusing of a decision for someone that you're getting something a third of the dose versus if they waited. What's your advice there?
So we don't have a lot of data on this in terms of waiting versus not waiting, but my recommendation that follows current guidance from expert bodies would be to get your child vaccinated when you can, the earliest that you can get them vaccinated. And if that means that they're 11 and they receive the pediatric dose, and then at 8 weeks, they are eligible for the adolescent and adult dose, they would receive that's a perfectly acceptable vaccine regimen. And it also allows that child to have a level of immunity that starts earlier rather than waiting for the 2 doses of the same dose of vaccine. So that's, where we're sitting right now. Certainly that could change, but at the moment, that's the recommendation for most expert bodies. The other thing that's important to keep in mind with this vaccine rollout as we get it started in the territory is we initially started the youth vaccine rollout for children 12 to 17, saying that they needed to be 12 years old for their vaccine. And then we shifted that to any child who's turning 12 in the year that they would receive the vaccine. So some kids with later birthdays who were 11 still got vaccinated with that 12-year-old rollout. For the 5 to 11-year-olds, we are using birth date. So that's a difference from the vaccine rollout that we had for youth in the past months. So children do need to be 5 when they get their vaccine. And again, as we get more information and as maybe younger age groups get approved, but children who are signing up for vaccine right now, they do need to actually be 5 or older when they get their vaccine. So the appointment is for children who will actually be 5.
Thank you.
Thanks for that, Dr. Pegg. Next, we'll go back to Emily from Cabin Radio. Emily, do you have another question?
Yeah, I'm interested in, I know right now there's a voluntary testing program for children at certain schools. I'm wondering if now that vaccines have been approved for that age group, if that's going to affect that testing program at any point.
I think that's another question for, I think Dr. Pegg, but Dr. Kandola as well, probably. So Dr. Kandola, you look like you're ready to answer, so please go ahead.
Yeah, so the at-home testing program we have for schools, that will still continue. And in fact, after the Christmas holidays, when everyone's back, we're hoping to offer any parent who wants to take that test in the participating schools ability to test their children. So we will still continue that because we are rolling out the first dose, but we still need to roll out the second dose, and we anticipate not that the vaccine uptake will increase as the months go on, but we still need to monitor for any school introductions, and the program has picked up cases, and because of that, we were able to prevent transmission for the school outbreaks. I think the overall goal is to minimize as much school disruption as possible.
Thanks for that. Emily, do you have a follow-up?
Yeah, I was just curious if someone could comment on that testing program of how it's been going and how effective it has been.
So as of late November, we've administered over 1,000 tests, rapid screening tests to parents, and we have picked up cases for that rapid screening test that we were able to isolate and prevent further transmission. The program has 13 participating schools, and I know in other places where there's been outbreaks, there's been interest in having that being a participating school as well. So far 13, and if there are schools who are interested, they can always contact us at cpho@gov.nt.ca. But it is it gives the parents the power to be able to do their own test at home with their child, where the child may be more comfortable in having a test done. And it allows us to pick up, as we said, cases early and minimize school disruption.
Thanks, Dr. Kandola. All right, well, with that, I think we will end our question period here for this afternoon. I know all of our panelists here have very busy schedules this week in particular. I would like to thank you all for attending and sharing information with us and with NWT residents. Thanks to Premier Cochrane, Minister Green, Dr. Kandola, and Dr. Pegg. I would encourage media and the public to please ask questions. If you still have them, you can reach media. You can ask further questions to the Press Secretary's office or directly to COVID Communications if you have other questions. And yes, thanks everyone again for joining us, and have a great rest of your afternoon.